There's not that much role for the tuning fork for facial sensation, but it is nice and cold. So we use it to check the sensation of cold in all 3 divisions of the trigeminal nerve. Is it the same all over?
Yes.
Very good. And if you're suspecting that there could be some sort of factitious sensation loss, you can actually check vibration sensation on each side of the forehead. And if the patient says that they can feel the vibration on one side but not the other, that may raise some suspicion. You can also check for hyperactivity of some of the reflexes of the face. You can check the jaw jerk. I want you to open your mouth just a little teeny bit and a little bit less. I'm going to just tap on your jaw, and you can look at the jaw jerk. So you've checked 5 and 7. You can check hearing by rubbing your fingers on either side and asking the patient if they can hear it and if it's the same. You can also do vestibular testing, and there's a variety of ways of checking this. Already you've done your eye movement exam and you've looked for nystagmus, which often indicates a vestibular problem. But one of the things that's very helpful is the head thrust. So when you're looking at the head thrust, what you want to do is ask the patient to look right at your nose, and then you gently grab the patient's head and move it a little bit from side to side like this. And you ask the patient to keep looking right at your nose. And then with warning, you just say, I'm going to move your head abruptly, okay? But you keep looking right at my nose, just like that. And one more time, just like that. And the patient's eyes should be able to remain exactly on your nose with the vestibular ocular reflex. Hers was perfect, of course. And the other thing you can do when you're looking for vestibular problems is look at vestibular ocular reflex suppression. And so for that, it's a little bit more of an active job. What I want you to do is hold your thumb out in front of you like that, and I want you to look right at your thumb. Keep your head pointed straight ahead, and then I can move your chair around while you keep looking right at your thumb. So I want you to look right at your thumb, and here we go. Keep looking right at it, and you can give it a nice little vigorous push, and she's able to maintain fixation on her thumb at all times. Okay, you can relax. So the next part of the testing would be your gag reflex, which tests 9 and 10. And so I want you to open your mouth real wide and say ah.
Ah.
So the first thing you can do is you can see that her palate is elevating symmetrically. And then if you have a tongue depressor, you can actually create a gag. I'm not sure that that's absolutely necessary if somebody doesn't have specific sensation loss in their throat, or if they haven't been having trouble swallowing, or if they're not actually having elevation of their palate appropriately. Then you can move down to 11, which is the spinal accessory nerve, and I want you to push your face against my hand, turn your head. There you go, just like that, and over here, and then shrug your shoulders up, and then H, hypoglossal, stick your tongue all the way out. And you can ask the person to put your tongue back in. Now put your tongue in your cheek here, and good, and over here, excellent. And even just looking at the tongue, often if there's trouble with hypoglossal nerve, you can see atrophy of the tongue. The next thing we're going to do is the fundus examination, which you can do with a handheld direct ophthalmoscope, which is falling somewhat out of favor, but is hugely helpful for almost all incidents. So what you want to do is get everything set up so that you can do this as comfortably as possible. So what you're going to ask the patient to do is look right straight ahead, off in the distance. If they're focused up close, their pupil will get smaller, and that's not what you need. You choose a smallish, for an undilated pupil, you want to choose a smallish light, not too bright. And then it's all about feedback, sensory feedback. So you're going to be having very poor vision for what's going on around you when this is happening, so you need to be able to know where the patient is relative to you, because in essence you're looking through a little keyhole. And if you've ever looked through a keyhole, which I know nobody ever does, but if you did look through a keyhole, you'd know that you have to get right up close. The closer you are to the keyhole, the better you can see through it. And she's got pretty small pupils, so we're going to need to really get ourselves coordinated to be able to see here. So I want you to look right straight ahead. Then you get yourself set so you can see the red reflex. And you can see my little pinkies out here because I want to be able to stop myself before I actually bash foreheads with her. So here we go. We're going to come forward. I am looking at the red reflex, coming forward, coming forward. I just touch her cheek with my finger here, and I'm right on the optic nerve. And I can see beautiful venous pulsations and a nice healthy looking optic nerve. And I can pop over here and just take a quick look at her fovea. Then you want to do it on the other side. And again, I'm using my hand on her shoulder, or I can use it on her head to make sure that I have good sense of where she is once my eyes are covered up. Again, looking right straight ahead. I'm going to come in and right in there on her optic nerve. And she's the world's most cooperative patient, so it works really well. We've covered the remainder of the cranial nerves, 2 through 12. You could check 1 if you wanted to, if you're concerned about a orbital frontal meningioma, for instance, and somebody who's got Foster-Kennedy syndrome. You can check somebody's sensation of smell with coffee. Try not to use alcohol swabs because they are doing more checking nasal pain rather than smell. So we have checked the remainder of the cranial nerves, 2 through 12, and we've done the fundus examination. I hope that you have found this helpful.
Good afternoon. My name's Aidan Cross. I'm one of the medical students here, and I've been asked to do a respiratory exam on you today. What that involves is having a look at your hands, checking your pulse, checking your blood pressure, having a look in your eyes, having a look in your mouth, and then asking you to take off your t-shirt so I can have a listen to your chest as well. Does that sound okay?
That's fine.
All right, can I start just by confirming your name?
Tom Grant.
And your date of birth?
The 4th of August 1987.
Fantastic. And how would you like to be called today?
Tom's fine.
All right, Tom, would you mind just lying down for me? All right, would you put out your hands? Spread out your fingers and lift your hands back. Great. Now can I have a look at your hands? So would you put them out again? Just going to squeeze on your finger. All right. And now would you turn your hands over for me? Now I'm just going to examine your hands. And the other one. Now you just put your fingers together like that for me. That's great, thank you. Now I'm going to check your pulse. That's great, thank you. All right, now I'd like to check your blood pressure. Is that okay?
That's fine.
Have you had your blood pressure taken before?
Yes.
All right. And do you have an arm that you prefer?
No preference.
All right. So this shouldn't hurt at all, but let me know if it does. That's great. Okay, I'm going to inflate it a couple of times. It shouldn't hurt, but let me know if it does. Is that okay?
That's fine.
All right, I'm going to do it one more time, all right?
Okay.
That's great, thank you. Now I'm just going to examine your eyes, okay?
Okay.
So now would you just look up for me? Can I just lift your lids down and look up for me? And now if I pull your eyelids up, can you look down for me? Thank you very much. Now would you open your mouth for me? Stick your tongue out and now put it to the roof of your mouth. That's great, thank you.
Thank you.
Now I'd like to have a feel around your neck and feel for any nodes or lumps in your neck if that's okay.
That's okay.
Alright, would you just take off your t-shirt for me and put your legs around the other side? Now would you just lift your shoulders up and push them forward for me? That's great, you can relax now. Alright, now I'd like to examine the nodes in your armpit, so would it be okay if I just do that?
That's okay.
Alright. So would you just give me your arm and just let me take the weight of it? I'd like to do the same on the other side. And just let me take the weight of it again.
Okay.
That's great, thank you. You can just lie down again. Okay, now I'd like to press down into your tummy. Do you have any pain anywhere?
No.
Okay, well do let me know if it hurts at all. Would you just look to your left for me? Okay. That's great, thank you. Now I'd like to just examine your neck, if that's okay.
It's okay.
Great. Now I'm just going to examine your chest. I'm now just going to continue examining your chest. Would you just lean over for me? That's great, thank you. Now just take in a deep breath for me. And out again. That's great. Now I'd like to just have a tap over your chest if that's okay.
Okay.
And would you put your arms behind your head so I can do the same just under your armpit? Fantastic. Now you just relax again. I'm just going to press down on your chest. And would you just say 1, 2, 3 for me?
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
All right. And would you put your arms behind your head again?
1, 2, 3. 1, 2, 3.
That's great. Now I'd like to have a listen to your breathing. So would you just continue to breathe normally for me? All right, now would you put your hands behind your head again for me? That's great. I'd like to do the same again, but this time would you just say 1, 2, 3 again for me?
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And put your hands again behind your head.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
All right, now I'd like to do all that again, but on your back. So would you mind just leaning forward for me and putting your arms like this, just crossing your arms. Okay, now I'm just going to do the same thing again. Would you just say 1, 2, 3 for me?
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3.
That's great, thank you. Now I'm just going to listen to your breathing again, if that's all right. So just continue to breathe normally. Okay, would you just say 1, 2, 3 again for me?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, while I'm here, I'm just going to press into your back as well, if that's okay.
Okay.
I'm just going to press on your back now. That's great, thank you.
Thank you.
That's great, would you just lie back down for me? Now I'd like to have a feel of your leg, if that's okay. So I'm just going to lift up your trousers and pull down your socks. And just press here for 10 seconds. Okay, that's great. Thanks a lot. Okay, that finishes our exam, but I'd just like to check your peak flow. I'd like to check your inhaler technique. I'd like to check your spirometry results, and I'd also like to check just the nodes around your groin as well. Would that be okay?
That's fine.
Okay, you can put your t-shirt back on now. Thanks a lot.
Thank you.
Do you have any questions at all?
No questions.
All right, great.